Well, hey, everybody. Welcome to day 6 of the 12 days of articles in review. My name is Mary Coughlin. I am a neonatal nurse practitioner by training and the president and founder of Caring Essentials Collaborative. And there is just so much new literature out there. It's just so wicked impressive. And I find myself running down a bazillion rabbit holes. And I did take the time yesterday after the article in review to really comprehensively and thoroughly read through Cooper's paper. And I really think that you'll find it very informative and even maybe inspiring if you're thinking about going down that trauma-informed pathway, which is really what the Academy of Pediatrics is recommending. I think you'll find some really good gems and guidance in that paper about the impact of that paradigm. Today's paper is also a 2021 paper, and it was published in Advances of Neonatal Care. The lead author is Dr. Linda Franck, a world-renowned nurse researcher, and just a dynamic speaker, and just all-around wicked awesome lady. And her passion, her research passion, and focus in her career has always been really that family-centered focus, that family, the impact of the family and the role of the family in the care of their critically ill infant. And so I was delighted to come across her paper entitled A Multisite Survey of NICU Healthcare Professionals' Perceptions About Family-Centered Care. It appears that the information that they've gathered is pre-COVID information. And I like how at the end of the paper, I'm just scrolling down to the end, where the authors actually say, the findings from this study provide a contemporary pre-COVID-19 baseline against which NICUs can then compare their staff's perceptions of current and necessary practice with regard to family-centered care. So the paper in review, really, really nicely done, with a very extensive and thorough background and significance of family-centered care. And I like how they really call out, I mean, just like any practice, if you're really scratching your head and trying to figure out why it's not being adopted and integrated into the culture of care, you really need to look at the professionals' attitudes about that practice to really start to uncover and unbundle what are the barriers. And so the aim of this study was to describe views of NICU healthcare professionals with respect to their current practices of family-centered care and compare their beliefs about their current practices with their views about the necessity of the family-centered care practices, and then finally to determine relationships between individual or professional characteristics and perceptions of family-centered care. So it was a comparative survey analysis derived from a multi-center quasi-experimental study comparing usual family-centered NICU care with mobile enhanced family integrated care. Healthcare professionals were recruited from 6 geographic and demographically diverse NICUs in California, participating in the baseline family-centered care phase of the study. The study was approved by the IRB. And so all nurses and providers, which included neonatologists, fellows, residents, and nurse practitioners working at the sites during the survey period were invited by email to complete the online survey. The survey that they used, the tool is called the Family-Centered Care Questionnaire Revised, and it's a 45-item measure of health professionals' perceptions of the practice and importance of 9 core dimensions of family-centered care. And it's on that Likert scale of 1, strongly disagree, to 5, strongly agree. So it really gave them a good flavor for where the professionals were on this continuum. As I scroll down now to share with you the results of the study, they had a total of 897 NICU staff received the survey, and let's see how many of them completed it. And 382, 43% of the folks completed one or more of the FCCQR current practice subscales. Of these respondents, 169 also completed one. Okay, so the staff members who did not complete the necessary practice scale did not differ from those who did with respect to professional role, age, experience, or current practice scores. I'm just kind of like running through the sample characteristics that the authors define. They review the psychometric properties of the tool, and then they get into the nitty-gritty of current practice compared with necessary practice. And this was really, I think, where it gets interesting, at least from my perspective. So on the necessary scale, and they have some really great graphics to really help you kind of like sort through all of this data, but on the necessary practice scale, so basically, you're asked, is this necessary on a scale of 1 to 5? And then, is this part of your current practice on a scale of 1 to 5? And so many of the family-centered care practices were recognized as being necessary with the highest mean necessary practice subscore was 4.5. However, when it was asked about whether or not these practices were current practice, it didn't match. Okay, so it was less likely to be the current practice, although the clinicians did indicate that they felt these practices were important. And so some of the categories, looked at family is the constant, parent and professional collaboration, recognizing family individuality, sharing information with parents, parent-to-parent support, developmental needs, emotional and financial support for families, the design of the healthcare system, and the emotional support for the staff. And so the majority of these things that I just shared with you were ranked, like if I just really quickly add it, it was 4.4, the total scores, the mean of all of those categories. But in the current practice, it received a value of 3.64 on a scale of 1 to 5. So although they recognized that it was necessary, it really wasn't part of the current practice. And so, really trying to figure out, where are the barriers? What is the situation then that is restraining these clinicians from providing the necessary practice? And this was pre-COVID. So I think we can, probably say we can understand a deviation in the current practice given the current constraints within COVID, but in a pre-COVID world, what's the deal? What's going on? So I'm going to just scroll down here. The 3 highest and lowest scoring items on the current on the current tool. The highest ones were staff work with families to determine the level of participation in direct care and decision-making that suits the family's needs. Staff encourage parents and siblings to come and go at any time. Let's see, how is this rated? And then the lowest scoring ones were parents and siblings are involved in staff orientation and continuing education programs. And again, these indicators were all evidence-based best practices. And so, the fact that they weren't really being part of the current practice, even though they were identified as being important, kind of does speak to deeper challenges, right? Deeper cultural challenges within the NICU that are limiting the adoption of these best practices. There's a really nice comprehensive discussion here about the paper. And then, of course, just like any good paper, they do talk about the implications of this study and what needs to be studied, what we know, and what we can do today. So I thought it was a really good paper. The lack of consensus about measurement of family-centered care attitudes, knowledge, and practice remains a major barrier to improving the design and evaluation of NICU family-centered care interventions aimed at healthcare professionals. This is kind of their, the summary of the paper. And I like that they do recommend ongoing investigation and evaluation, and I think, when I was kind of trying to identify which article I wanted to talk about today, I did go down a lot of different rabbit holes. There's lots of really great papers that are talking about how the COVID-19 pandemic is really negatively impacting families in the NICU, and the implications of that negative impact aren't just, kind of a short-term phenomenon, but have lifelong implications. And so I think having this information, right, really understanding where people's attitudes are regarding family-centered care, and now understanding the real biologic implications of withholding evidence-based best practices in family-centered care, really begs the question, what are we doing? What's going on here? I just feel like there's a lot of information out there, and I hear lots of off-the-cuff temporal comments about the limiting footfall in the NICU and restricting parental presence and all that kind of stuff. And although it may seem like a short-term fix, the sequelae associated with those practices, with kind of minimizing the importance of a family-centered care model, really needs to be reevaluated. I mean, it's really, I'm going to say a really strong word right now, but it's inhumane. What we're forcing these families and babies in crisis to endure, superimposed on an already incredibly traumatic situation. So this is, I think, the authors here present us with a really great benchmark. And now we're being called to really critically evaluate and weigh, right, the risks and the benefits of our current approach to family-centered care within this global pandemic. Are we really doing no harm? Personally, I believe we're causing an extreme added burden of harm to these families who are already overwhelmed and already traumatized by their current situation. So, and again, if you're looking for more evidence, more research with regard to this topic, you put Linda Franck in your PubMed search, and you're just going to find a ton of research, all related to the family and the role of the family in the care of critically ill babies and young children. She's prolific and has some really powerful data that we need to embrace and not wait, 15, 17, whatever the new timeline is between research results and adoption at the front line. We really need to get on the ball and address these significant gaps. The future of our society depends on it. And this is not just a US issue. I like in the background of this paper, they referenced studies from other, geographic regions in the world that have been, looking at this phenomenon. There was a Japanese study, there was a Brazilian study, just kind of going quickly through this. And I know that there are other national and international studies examining what the situation is in their world with regard to family-centered care. It is a global crisis, and we really need to step up if we're really going to truly serve these families in authentic, compassionate, meaningful ways that are going to not just enable them to survive their crisis, but to thrive and flourish. So, so that's it. That's today's paper. You've got to check it out. If you'll look over here in the chat box, I put the citation up there in the DOI. Read the paper, okay? I'm just giving you a cursory overview and not doing the justice that the paper really deserves in these little reviews. It's just to kind of like, give you an appetizer. So that's it. Okay. So listen, thank you so very much for day 6. I'll be popping this up on the social media shortly, and I look forward to seeing you tomorrow at the same original time. I'll be doing this at 10 a.m. Eastern time, and hope you can join me live. And if not, I'll see you on social media. Take it easy and Happy New Year. Bye.